Dr. Colin from Family First Chiropractic. So today I'm going to be talking to you about common knee injuries. Now, first one here, really common one, everyone's heard of it before, the ACL injury or an ACL tear. Now, ACL, what that stands for is anterior cruciate ligament. Not super important that you know the name. What's important to know is that that ligament keeps your shin bone here and your thigh together. It keeps it nice and stable. That's what makes up your knee joint. When that ligament is torn, now that bone is moving. It's not stable anymore, so you're walking around and that does not feel good, and that can lead to more issues in the knee joint. So it's important that we figure out if you have one of those going on and that we know how to take care of that. Now, the next injury I want to talk to you about is going to be patellar tendonitis. It's also known as jumper's knee. Reason it's called jumper's knee, most of the time you get it from repetitive motions, like jumping all the time. If you think of somebody like a track athlete or a basketball player, they're going to be repeatedly putting stress in on that patellar tendon in there. What that does, it starts causing little tears in the tendon. Those little tears are damage, causes inflammation, swelling, pain with that too. The next thing I want to talk to you about is going to be runner's knee. So a little bit different than jumper's knee. Runner's knee is an overuse injury in the same way, but where it's different is that there's not any direct damage done. There's inflammation going on in there, but nothing is torn, sprained, strained, nothing like that. It's just repetitive stress overuse injury. And with runner's knee, you tend to get more of the popping, cracking, what we call crepitus in the joint going on in there. Now, another common injury you might have heard of would be a torn meniscus. Now, what the meniscus is that's a thin piece of tissue that goes in between your shin bone and your femur here, and it works as a shock absorber for your knee joint. So it's, like I said, real thin. That makes it prone to being torn when there's a strong hit in on the knee, a hit, a twist, a wrong force in there, and that will actually start to break apart that shock absorber. And that becomes an issue with the meniscus injury. People most often say it feels like gravel in there. It's really poppy, clicking, grinding, and they can feel that. Now, not getting that addressed, not knowing that you have that going on, continuing to use it, that can start to cause more damage to the joint. So another important one to know that we need to get in there and get that taken care of, take the pressure off the knee joint so you can heal. Last being arthritis. Everyone's heard of arthritis as well. Arthritis, what we're going to be talking about is osteoarthritis. That in particular is more of what people attribute to being the wear and tear on a joint. So over time, using it, the stresses, the things that we do, it's going to damage the joint. Especially if you're ever an athlete or you didn't take perfect care of your joints, you were a little hard on it, then that's going to lead eventually down the road to osteoarthritis. With that, again, stiffness, swelling, lots of pain, especially when you try to use it, and especially first thing in the morning. As you get up and use it, it starts feeling better and better. That's, again, another hallmark that you could be dealing with a lot of osteoarthritis in the knee.